Medical workers of Reddit. Who is the weirdest patient you've had to deal with? Sent a male patient into the bathroom to collect a urine sample. Took him much longer than expected. He misunderstood and gave a semen sample. This reminds me of a post. Someone was talking about how their 12-year-old self thought a urine sample meant a stool sample. So they came back out of the bathroom with a cup of shit for the doctor. Any who shove things up their ass and then pretend they have no idea how it got there. And believe me, it happens more than people realize. A man who ate things to hurt and punish himself. Whenever he felt bad, and he felt bad very often, to the extent, for example, if you gave him a glass of water, he would feel he was putting you out and would feel the need to self-punish. He would eat coins, nails, buttons, string. He got brought into the hospital because he had eaten a battery. After a while, most psych patients fit into a category of expectations. He always stands out in my memories of patients. When I was in undergrad, I did some observation in an assisted living facility with a physical therapist. The most intriguing patient I had was a woman around the age of 70 who came in for sudden blindness. It turns out she had a UTI that got so out of control. It turned into a kidney infection and led to acute delirium. In addition to that, her blood pressure spiked randomly so high that it affected her glaucoma, causing her to go completely blind overnight. The combination of sudden blindness and delirium caused her terrifying hallucinations. She kept seeing gigantic monsters at night in her bedroom, as well as the dead bodies of her grandchildren, which were actually still living. Over the 3 weeks I saw her, it went from her saying things like, "I know I'm out of it. I'm just seeing things that seem so real," to walking into her room to find her having full conversations with multiple family members at a dinner table with side comments and all, when there was actually nobody in the room. She introduced us to all the people she was hallucinating, and when we got her up to walk her out of her room, she was reaching out her hand to brace herself against the table she saw, but wasn't actually there. I've never seen a more heartbreaking patient in my life. 3 weeks before she came in, she was living alone and waiting tables full time, and by the end, she was completely out of touch with reality and had to move to a nursing home for full-time care. Patient was always masturbating, and she didn't stop when you came in the room. She was on our floor all the time. Anyway, heart monitor stops showing up and another nurse goes in to check on her. Patient has clipped the teleleads to her nipples. Our doctor here. Here's a weird one. A patient came into the ER one night saying she was infected with worms. She told me she had been noticing worms in her mouth and in her urine and stool. She said it had been happening for a few months and it was worsening. She actually brought a sample of these worms. She brought them in a glass, covered with saran wrap. I held it up to the light. Looked like saliva with clumps of mucus in it. As I was trying to convince her that it was just normal spit, her parents arrived. They had driven down from out of state in a panic that their daughter was dying of a parasitic infection. Mom and Dad were livid with me when I suggested that it was in her head. There's actually a delusional disorder named delusional parasitosis. They couldn't accept the fact that her daughter was crazy. They asked for a G consult so someone could look into her infection. So I opened up the glass, and with a gloved hand, I pulled out the worms. I ran it around in my fingers and showed them. The dad's reaction was something to behold. It went from "don't be ridiculous, she's sick," to "what the hell are you doing?" to "wait a second, that looks like just spit," to "holy shit, my daughter is fucking crazy." I saw it in Dad's face. And then he turned to his wife and said, "Honey, I think we need to talk." I left the room, and they took her home 15 minutes later. I offered a psychiatric eval, but they said that they would go to her mother's psychiatrist. They are not worms, just crazy. Parents mortified. I used to work as a CNA in high school. There was a guy that lived there that would jerk off as he pulled his Foley catheter out. There would be blood, urine, and semen all over the place, usually his bed. He eventually had to have his hands strapped down. It was either that or he would get a really bad infection or irreversible damage done to his urethra. I felt horrible for the guy. He didn't really even know where he was and didn't live too long after I started working there. He just wanted to get off as far as I could tell. EDIT. Catheters have a balloon at the end of them that is inflated in the bladder to keep it in there. He pulled the thing out while the balloon was still inflated. That is why he would bleed. 54-year-old psych patient ran away from her care home without pants on. Was hanging out with some local teenagers who were smoking. The smoke made her start hearing voices so naturally. Chest pain ensued. She was afraid to step into the ambulance and stared at the light, talking about how hot she was for 20 minutes to the hospital. 300 pounds easily, with a face covered in dry spaghetti or something. It then took half an hour to convince her to step out of the ambulance because she was afraid it was going to hurt. Now once out of the ambulance, she proceeded to insert her fingers into her anus. She then proceeded to pull them out and lick them. Rinse and repeat. Come 10 more minutes we get her to try. Good God. Please never again. It wasn't all that weird. More along the lines of gross. I had to wipe a guy's ass and came up with a handful of maggots. He had some severe brain damage and told me he brought visitors. Used to be a psych tech CNA during nursing school. Every patient you encounter is weird, but the one that stands out to me the most was a female with schizophrenia. She would piss anywhere on our unit, literally anywhere. She would come running out of her room butt-ass naked, pop a squat and drain the main vein in the middle of the hallway with everyone watching. Same patient another day. She turned her call light on, so I went to check on her. I walked in to find her in the bathroom with urine in a cup. She called it her magic juice and proceeded to drink it. Many stories to tell of weird patients. Psych patients amaze me. Has to be the anal explorer. The patient was involved in some type of accident resulting in neck injury. Instead of waiting for the enemas and laxatives to take effect after a week of no bowel movements, he asked for a washcloth. We come back a few minutes later, he is digging poop out with his fingers, all while ranting about being sick and tired of waiting. I don't know if I'm allowed to answer, as I only just finished my 3rd year in medical school. We started clinical rotations, but we did have a few very interesting cases in our rotations. The first was the usual I fell on something, anal penetration gone wrong case, except it was a Barbie doll, so that was kind of amusing. Number 2 that really stands out was an infected genital modification. It was swollen like a grapefruit and discharging something awful. I don't know how it got like that, but I'm guessing there was shame involved. We had our attending supervise a removal and for antibiotics for that one. The smell, well, that was something I probably won't be able to top for a few years. We also had a pain seeker who insisted she was a member of One Direction and needed narcotics to make the screaming girls go away. That was creative. Literally nothing wrong with this woman, other than she make up a strange story to get narcs. One patient I had didn't have people voices in her head. She had cat voices. She would just sit there and talk to all these cats, and then yell at me for not letting them come inside because they were freezing to death. I'm terrified of cats, so the whole thing just weirded me out. Had a convicted child molester. One who diddled his own sons when they were very young. Guy was elderly, in really bad shape, and had the beginning stages of dementia. Right before leaving his room, I asked him if there was anything else I could get him. He responded with some sexy young bows. I just stopped, stared at him for a second with my mouth open, and turned around and walked out. From then on out, I didn't say a word to him other than what was necessary. I also had an elderly dementia patient who insisted I was a demon there to torture and kill her. I work as a psychometric in a psychiatry clinic. Just had a patient the other day that peeled the one dead skin off her feet and chewed it. She liked the texture. We had EMS bring us a trauma too, found down. Poor old guy was very mentally ill, off his meds, physically ill, and malnourished. He had likely been in and out of consciousness or lucidity for days, and every time he was capable had tried to stab himself to death with glass shards and a nail. He had swelling, purulent, multi-day-old wounds, newer punctures, and torn, scraped, ripped, raw skin all over. He had been bleeding and fouling himself who knows how long. And when they brought him in, he was so exhausted he could barely twitch, but was fighting and spitting at the firefighters. My mom was a medical assistant at a county med clinic for low-income folks. One day a guy comes in complaining that he has a cyst or something blocking his anus, and that he hasn't had a BM in 3 days and that he's unable to sit or bend over and is in extreme pain. They pull a curtain, lay him over the table. The doctor whips out some tools and locates and then lances the cyst and shit everywhere. Worse than the dire he has seen in Dumb and Dumber. On the walls, the ceiling, the curtain, the countertops, the nurses, the doctor, in people's hair. Just everywhere. Also posts, everywhere. As if someone set off a chocolate cannon but with poo posts. I work in her. Guy comes in with stabbing chest pain. X-ray shows a bunch of sewing needles, mostly in his esophagus. The one that poked out and was poking at his heart. Hence the stabbing chest pain. Guy forgot to mention that he swallowed needles and had to be taken to surgery. He died a few weeks later when he stabbed himself in the chest with a knife. I was rounding a few months back, and a guy gets wheeled into ICU smelling terrible. I walked over, and the dude had maybe the most macerated legs I had ever seen. There were things moving on the bed, and the suction container was full of maggots. Turns out dude had been weaving on the road. And when police pulled him over and opened the doors, maggots fell onto the road. He got taken to the arrested, taken up to ICU and very rapidly debrided, then bilateral above knee amputated. He actually made it out of the hospital, but I cannot imagine waking up one day and having no legs. I really wish I knew where he was driving, though. My mom is a nurse. She had a patient with some sort of mental disorder who loved whacking it off. And I mean he was nice enough to do it in private, and his collection of porn, he just loved rubbing one out. Well, one day he decided he wanted to bring God into his life, so he began reading the Bible. When somewhere he got it into his head that God had given him his penis to reproduce, and not masturbate, and that masturbating was a sin. Now he didn't have the social skills to attract a mate, so he cut off his dick with a butter knife. Also, my mom was pregnant with me at the time, and she didn't want to know the sex of the baby, aka me. She figured she would be happy with whatever came out. Well, a doctor told her I was to be a female. This man disagreed with that and said I was going to be a male. In fact, I would be the next Jesus and I would bring peace and harmony to this world. I would heal people and make the world perfect. Well, ladies and gents, it's been a couple of decades. Fuck peace ain't going happen. This Jesus is throwing in the towel. Thank you very much for watching. In the comments below the video, write if you have met any strange people. And don't forget to watch our other videos.